A generous donation is giving Dell Medical School at the University of Texas ongoing support to improve the health and wellness for the homeless and other vulnerable populations. Austin's philanthropists John Paul and Eloise DeJoria have given $2 million to create the endowment. John Paul, thank you so much for joining us this morning.
You're very welcome. Very, very welcome. Yeah, it was our pleasure. We put in quite a few $100,000 there to try and take care of them during this unbelievable epidemic that's been going on. But we knew that they needed something long-term, not just a short-term bandage. Well, when you're pouring out $500,000 to $1 million on a short-term bandage, and you realize that's going to go away, the proper thing to do is find a long-term solution. So getting together with Dr. Cale Johnson there at the University of Texas Dell Medical Center, we were able to put together I donate the money, obviously, through my family, Peace, Love, and Happiness Foundation. Now, we donate things that are long-term, they make long-term changes. So we had no problem writing another $2 million to them to create this vehicle, and they call it a chair, but it's totally directed to help the homeless and the disadvantaged. Now, here in Austin, we're doing a heck of a lot of things for the homeless, whether it's through mobile loaves and fishes, the community, some new ones we're starting, what we're doing, the Salvation Army. But I believe right now we are treating far in excess of 1 million people, but it's a long-term one. So this chair was dedicated, number one, find the solutions to eliminate this. That's number one. Number two, follow through to make sure those solutions are applied. This chair is going to go on forever. The money that's made off of it goes into paying the professors and the other people to find research, find out what the problem is, what the solution is, more important, the solution, and what we can do to follow through with that solution. Now, what happens, let's say, in 18 months or a year when there are very few homeless on the street? Well, hopefully that's going to happen. We think it just might. However, now it shifts to that goes towards the disadvantage. So even if we eliminate homelessness, which is possible, you never can tell. We all would love to, but then it goes towards the disadvantage that need medical services. So yay, University of Texas, the Dell Medical School there, and of course our John Paul DeJoria Family Trust that believes in we're Texans, and boy, we're helping one another out. That's what this is all about. Love Texas.
And when the announcement was made about your endowment, the generous donation you made, Dell Medical School said that in order to help these vulnerable populations, you need to come up with innovative care models. You mentioned a little bit of it. This is Dell Medical School's straight medicine programs, research and training the next generation of doctors skilled at caring vulnerable populations. Will this be able to happen?
Yes, it's going to happen. It's already happened. I've already put the $2 million in, and I plan to check on it every year. It's definitely going to happen. In fact, within about 30 days, I'll probably be meeting with Dr. Mercer and Dr. Johnson there to see what are we implementing now and what is our next goal and our next goal and our next goal. Yes, this is happening. I've already put the money up. There's no doubt. And it'll be something that'll go on and on and on and on and never end. That's how it's been put together, a long-term solution.
You yourself, many years ago, experienced homelessness and were able to still make your dream come true. Did this come into play?
Yes, America still works. And boy, this is the message I want to get out. When I heard of Paul Mitchell, I lived in the back of my car. I seriously lived in the back of my car. And it's a little hard, $700 living in the back of your car. And after several weeks, a young lady took pity on me and let me stay in her house for a couple of weeks or a couple of months. I got back on my feet a little bit anyways. But I know what it's like. And when you're living in a car or on the street or in a tent, you feel terrible. You do not feel good. When you're homeless or without a job, you just feel just really not comfortable. The thing is, we got to give you your dignity back, which you already have anyways. We're just bringing it back a little bit more, your enthusiasm back, and knowing that somebody cares. That's a big deal. Somebody cares. Well, when you get a government trying to solve it, no disrespect to our government. Okay, again, no disrespect. They do it the best way they can. But the private sector does it a heck of a lot better because we have run businesses. We know how to get an end result. And not all, but many people in politics have never even run a lemonade stand and come up with with business solutions. Well, this is a business solution. How do we apply things, not just ideas and philosophies, but how do we take that technology and apply it so it actually works? And that's what this is all about. Now, being there before, I know some of the pitfalls, so I can get right on in there and talk to the people and say, hey, I know what it's like. I've been there. But also, we are working together, not just with my experience, but with experts from the University of Texas to come up with newer and better ideas and solutions. And yay, let's do this together. We're going to eliminate it. Another thing too, our citizens should realize, the more people that think about, we're going to eliminate this problem with solutions. We're going to eliminate the problem and not look what the problem is. All of a sudden, everyone's focusing their thinking. Very important. Thinking makes it happen. Their thinking is, we're going to do it now. Oh, look at those bumps on the street. Oh my God, they're degenerates, move them somewhere else. Quite a few of those people, just like you and me, in fact, the majority, had a bad break. Let's give them a break.
You've already done a lot. Your foundation has already done a lot to help many people, and it's going to go a long way. Part of the solution. John, thank you so much for spending some time with us today.
Oh, and thank you for giving me the opportunity to do it. We love it. Peace, love, and happiness to all of our fellow Texans. Yay.
Thank you again.